What is gout? Gout is a painful and potentially disabling form of arthritis. The first symptoms usually are intense episodes of painful swelling in single joints, most often in the feet, especially big toe. The swollen site may be red and warm. Any joints can be affected. Fortunately, it is possible to treat gout and reduce its very painful attacks by avoiding food and medication triggers and by taking medicines that can help. What causes gout? Gout occurs when excess uric acid collects in the body and needle-like urate crystals deposit in the joints. Uric acid is a normal waste product of the body. This may happen because either uric acid production increases or more often the kidneys cannot remove uric acid from the body well enough. Certain foods and drugs may raise uric acid levels and lead to gout attacks. These include shellfish and red meats, alcohol, especially beer in excess, sugary drinks and foods that are high in fructose, some medications such as low-dose aspirin, certain water pills like hydrochlorothiazide and Lasix, and medicines used in organ transplants such as cyclosporin and tacrolimus, also called as Prograf. So what are the symptoms of gout? Gout usually presents with sudden attacks of severe pain, most often the big toe, ankle, or the knee. Often the joints turns red and swells. Usually only one joint is affected, but some people have pain in more than one joint. Pain is worst at the beginning of a gout attack, then gets better within a few days to weeks. With long-standing gout, some patients can develop nodules over their joints, most commonly over the elbows. How do you test for gout? Your doctor can take a sample of fluid from the joint that is in pain or swollen. If he or she finds typical gout crystals, then you have gout. Even without checking fluid from a joint, the doctor might still suspect gout if you have had a pain and swelling in one joint, especially the joint at the base of the big toe. Your symptoms completely go away between attacks, or your blood tests show high levels of uric acid. How is gout pain treated? There are few medicines that can reduce the pain and swelling. Make sure to keep it on hand all the time. That way, you can take it as soon as you feel an attack starting. Medicines work best if you take them as soon as symptoms start. What are the medicines? Non-steroidal anti-inflammatory drugs. This is a large group of medicines that includes ibuprofen, also called Advil or Motrin, naproxen, also called Aleve, and indomethacin, also called Indocin. This group of drugs might not be safe for people with kidney or liver disease or for people who have bleeding problems. Colchicine. This medicine helps with gout if taken as soon as the pain starts. It can cause diarrhea, nausea, vomiting, and stomach pain. Steroids. The most common steroids used are prednisone or Medrol. Steroids can reduce swelling and pain. It can be taken as pill or as shots. Your doctor can also put some steroids in your painful joint. How do you prevent gout? There are medicines that can reduce the chances of having gout attacks. They work by reducing the amount of uric acid in the blood. Examples are allopurinol, febuxostat, probenecid. Your doctor might also want to check that uric acid levels get low enough to dissolve the gout crystals and change the medicine dose if needed. These medicines can actually increase gout attacks when you first start taking them. Your doctor will prescribe low-dose colchicine, non-steroidal drugs, or steroids to prevent these attacks. It is important to keep taking your daily medicines normally even if you have gout attack. Lifestyle modifications. Weight loss will help relieve gout. Cut down, particularly if you have noticed this to be related to gout flares in the past, like red meat and seafood, alcohol, especially beer, foods and drinks with high fructose corn syrup like sodas, cakes, cookies. Foods that can help gout. Low-fat dairy products like low-fat milk, cheese, yogurt, whole grains and vegetables.